everybody. My name is Robert Morris. I'm one of the chief residents here at the Temple Anesthesia Department. I've really loved my time here at Temple. I feel like for me it was really a perfect fit. The residents that I've seen truly thrive here are the ones that really like to embrace a challenge, that see residency more as an opportunity than a hurdle, and those that like to work together as a team.
I want to be a guy to introduce you to your intern year. Temple is a great program. What I want to tell you is that you're an anesthesia intern, you're not a medicine intern. So, the exciting news is that you get 2 months of anesthesia that you get to rotate through the OR and do your own cases. And on top of that, you get 1 month of anesthesia research, which is unheard of in any other program. You'll spend some time in the floors, ED, and electives where you get all your weekends off, and you will also spend time in ICU. 1 month in the respiratory ICU. Temple is a robust lung transplant center. You will learn about VATS, ECMO, ultrasound. Here you will learn so much about the lung physiology. It will be the perfect primer before you start your anesthesia year.
Temple has a very strong educational curriculum. Each week, all CA 1s, 2s, and 3s have a half-day protected time.
I'm one of the CA2 residents, and we're here in the heart room. The cardiac anesthesia experience here is unparalleled. We've also been the #1 busiest lung transplant center in the nation by volume for the last 3 consecutive years. We're one of the centers on the East Coast, one of the few that performs a large number of PTEs. Our residents are always involved in these cases, and we have a rich exposure. Also, we're exposed to many other subspecialties early in our CA1 year, and it helps for fellowship planning and decision making, and it really helps you to solidify all the knowledge that you gain from your reading.
Temple is a level 1 trauma center. This is an example of one of our trauma room setups. We see a lot of operative trauma here, so we always have at least 3 rooms ready to go during the day. Being part of a trauma is very important. It's definitely a multidisciplinary effort, and it really, you get thrown into things, you never know what's going to happen, but it's definitely exciting and you learn a lot from it.
Hey guys, I'm getting ready to do a block. Here at Temple, we have really busy orthopedic, vascular, and general surgery services that require our help. It's a blessing in a way that we don't have a pain fellowship because all of our residents get to do all of the blocks for these procedures. We have separate regional anesthesia and acute pain rotations. We get our numbers really quickly and many more, so we become very, very competent.
Hey guys, Rob here. I'm in one of our OB ORs. We have 3 operating rooms up here that we're able to use. That way we can run 2 cases concurrently with one as a backup if need be. We're usually staffed by 1 resident and 1 attending at all times, so you get 1-to-1 coverage up here. The OB service is pretty busy. We see 2,500 plus deliveries a year. It averages out to about 7 or so a day. You will get lots of experience with epidural placement. Most of our residents hit all of their numbers in their first rotation, their first year. And over the 3-year residency, you usually get 150 to 200 epidural placements and plenty of spinals as well. The population we serve here is usually medically complex, so we are getting a lot of high-risk cases, a lot of very interesting things they may not see elsewhere. So we think it's a really great experience.
Our pediatric anesthesia rotations occur at both the renowned Children's Hospital of Philadelphia and at St. Christopher's Children's Hospital, providing experience with different practice models. At both institutions, we work with leaders in the field. In our CA3 year, we are offered wonderful opportunities to travel abroad for international elective rotations in Kijabi, Kenya, in Ethiopia, and in Rwanda.
Our residents have a well-earned reputation excelling clinically. Our educational and simulation training too is really setting us up for success. In the last few years, we've had really phenomenal results in the fellowship matches, as well as our residents going on to private practice are really equipped well to handle anything that comes their way.
Hi, my name is Dr. Mark Goldberg. I'm an attending anesthesiologist here in the Department of Anesthesiology. I've been here for about 10 years now. I trained here. This was my #1 choice to pick. I am from the Philadelphia area. I knew that I was going to do my residency in the Philadelphia area, and I looked at all the programs extensively. And I felt that Temple University offered me the best clinical experience, and which is what I wanted out of an anesthesiology residency. I wanted to be the best clinical anesthesiologist I could be, and I chose Temple. And I believe I made the right choice. I chose it as #1, I ranked it as 1, and I would do it again. When I completed my residency, I went out into private practice for a couple of years. After 2 years, I received a phone call from my old chair. My old chair said, "Mark, I hear you're still in the area. You wouldn't by chance want to come back and work for us because we could really need someone like you." And I thought about it. I said, "Sure, I'll have a conversation." And I came back and I had a conversation, and that was 10 years ago, and I've been here since. It's been the best decision I've ever made, and I'm very happy about it.
I'm Dr. Juliana Salamanca. I'm one of the city anesthesiologists. I choose to be at Temple mostly because of the people that are around and the complexity of the cases, but mostly because the attendings here were worried about the other attendings, were caring about your colleagues, and help you out if you have any problem or anything with your patients or in your personal life. So it's a very careful and caring team.
Hi, my name is Dr. John Leibelsberger. I'm one of the attendings here, and a former resident. I decided to come back to Temple because it's a fun, exciting place to work. Lots of complex patients, and it makes it exciting each and every day. Specifically, I guess if you could pick a passion for me in life, it's acute pain, nerve blocks, regional anesthesia, and coming back here, which is nice to be able to teach residents, trying to make them experts as far as doing nerve blocks as well.
Hi, I'm Dr. Diana Feinstein. I'm the Director of Obstetric Anesthesia. I did my residency here at Temple and graduated in 2015. I did my fellowship and came back, as most of my class did actually. We all became very close friends, colleagues and family, and 5 of us out of 8 came back to work here as attendings. Temple is truly a place where you have family, you feel supported, you're respected. There's always someone to give you a helping hand. The cases are truly one of a kind, and you generally get to practice the true art of anesthesia.
I'm Mario Farias-Kovac. I am a resident graduate from 2019, and after that I stayed at Temple. I decided to stay at Temple at that time because I wanted to, get a little bit of more of the kind of case that I could do as an attending, doing them myself. And at Temple presented one of the greatest opportunities of having a wide spread of cases. During my time as an attending and without being fellowship trained, which is going to be my next step, I was able to do from EVARs to open cranies to open AAAs, which were pretty challenging cases for a new grad. And having the opportunity of have that network support of my colleagues and knowing the residents, knowing what all the skill sets that other people have, and knowing the place pretty well allowed me to be able to do those cases.
What I like most about being here at Temple is the early and frequent exposure to challenging cases. Also, within the residency, there's really a family feel. I feel like everybody's really looking out for each other and their best interests. There's a lot of support also within the department among the faculty, the CRNAs, the techs. Just about everybody's really looking out for each other, and I think that makes for a very good atmosphere.
Conscientious.
Diverse.
Adaptable.
Friendly.
Camaraderie.
Energized.
Team players.
Amazing.
Strong.
Driven.
Philly sports.
I love the people.
It's a big city with small town feels.
Living in Philly, the best thing is Wawa.
The food is so amazing.
Great fishing spots.
Biking in the river.
I love the food and that it's a walkable city.
I love the parks.
The restaurants.